Good morning, cover girls. The pup and I are riding around and getting it this Friday morning and wanted to make a longer form video about our what in the CapEX segment for emergency drugs. So I took a short form video about that, about the emergency drugs. And in this video, I want to take a longer form to talk about all of the things that go into providing oral conscious sedation and the costs associated. So at our different offices, we do provide oral conscious sedation for our patients, as we just think that's a really nice thing to offer our patients. It helps reduce anxiety. It allows our doctors to do multi-quad dentistry, and I think it's a true win-win for us and our patients. A lot of our patients absolutely love it as well. So anytime we can find a win-win, we're going to jump on that, and we provide it at a cost-effective way. The average cost for oral conscious sedation in the state of Indiana is between $250 to $300. We charge $125. The reason that they charge so much is this, and now I'm going to get into the CapEX segment. So in order to do oral conscious sedation, you have to have a sedation monitor. It has to be able to read blood pressure, has to be able to read oxygen levels. You have to have a pulse ox to communicate with that unit. Those units are $5,000. The pulse oxes are about $1,000. You got to get a cart. We do it so much, most of our offices have at least 2 sedation monitors, so we can do at least 2 sedations at one time, if that depending on the office or the provider. So there we've covered just the sedation monitor aspect. So on top of that, you obviously have to have the reversal agents. You have to have the emergency drugs in case something does go wrong. So again, all of those things, that is what Health First will provide us. That's EpiPens, that's adrenaline, that's flumazenil, all of those things. So if the patient doesn't handle the Halcion or triazolam well, we're able to reverse that. We're able to reverse that effect. So along with those AED units, our offices that do child sedation will have child and adult AED units. If it's just a facility that we do adult sedation, it'll just be an adult AED unit. And as you guys know that follow the channel, it's not just the purchase price that gets you. It is how much you have to restock or upgrade or update the equipment. So AED units, every 2 years battery expires. All of the adrenalines, EpiPens, all of that stuff, they expire within a year to 2. And so a lot of times in our Sharps container, which again, we pay for medical waste, we are just throwing away good medicine because it's expired. And really that's normally the hermetical sealing of the packaging. It's not the actual medication that expires. So, man, you just get double dipped. You have to pay to have your medical waste removed by true medical companies. Again, they have to prove that they're disposing of it the right way. So again, a lot of this stuff I just find to be really interesting. So for you guys at home, when you're curious why it costs so much to do oral conscious sedation, when maybe all you see is a nitrous tank and a pill that you're taking, you're adding up that math. It's like, man, why am I paying so much for it? It is all of these soft costs, right? I mean, the regulatory compliance, making sure we're doing this the right way. We're training on this stuff the right way. We're replacing the pulse oxes when they break. We're replacing the monitors when we have to. We have wheelchairs in all of our offices because again, once you're doing sedation, you're not going to be up and walking around and all that stuff. We're going to wheel you around. You're going to need an escort to drive you home. We go over all of those protocols and rules with our patients in real time, and we have documents for that. But these are just the things to maybe think about when you're going to your office or you're curious why costs keep going up. It's here in a nutshell. At our surgery center, we do IV sedation. I'm not going to get into that. That's a whole nother topic with a whole nother set of CapEX that go into that. But comment down below. Let me know what jumps off at the page of you, and even let me know how your oral conscious sedation experience has been, because again, a lot of our patients absolutely love it, and it's a service we're going to keep providing. It's just from a CapEX perspective, you have to figure out your pricing and you got to figure out how to do it efficiently, because again, the costs are real.